winter isn't just the season of snow and skiing. It's also, unfortunately for many, the season of the cold and flu. Right now, we have Dr. Kevin Shiley joining us from Catholic Health Systems. You are the Medical Director of Infection Control, and you're here today to tell us the differences between the cold and flu and what we can do to treat them both if we do, unfortunately, get them. So what are the differences between the cold and the flu?
Well, Lauren, the cold is typically a more mild illness. The common cold oftentimes is characterized by a stuffy nose, sometimes a sore throat, and occasionally a cough. And that cough oftentimes is really kind of from nasal congestion dripping back into the throat, although occasionally it can be a deeper cough. There occasionally are fevers associated with a common cold, but they tend to be relatively low. Kids tend to have a little bit more fever with common cold than adults. Influenza, which is oftentimes referred to as the flu, is a respiratory illness which is typically much more severe for healthy people and certainly for people that have other chronic medical conditions. So people with influenza tend to have a deep, dry, hacking cough. Sometimes they have a sore throat with it and occasionally a stuffy nose. But one of the most prominent symptoms of the flu is a high fever. Typically, they really start sweating and feel awful with it. And then another very common symptom is really bad body aches. People just feel awful, very achy, and they don't want to get out of bed.
That's right. Okay, so if you have not had a flu shot and you do unfortunately come down with the flu, what can you do? What relief is there? Or if you had a flu shot, either
Sure.
way.
Well, I mean, the most important thing about the flu season is getting the flu shot to prevent getting influenza. No vaccination is perfect, but it certainly seems to help prevent influenza in a lot of people, and it certainly helps people that have chronic medical conditions from having severe complications from influenza. Things that can be done if someone actually does get the flu are unfortunately mostly symptomatic. There is an antiviral medication out there called Tamiflu. And Tamiflu tends to work best if it's prescribed within the first 2 days of symptom onset. So it's important if someone really is not doing well that they see their doctor early to get the prescription if they have influenza. Otherwise, it's a lot of symptom relief, and that usually comes down to taking medications to help with fever, such as ibuprofen or acetaminophen, also known as Tylenol. Some of the other medications out there that are commonly labeled as, quote, cold and flu, it's not really clear how well those really help with symptoms. They certainly don't decrease the duration of illness, but sometimes they may help with a cough or the fevers and the aches and pains.
And we don't always hear so much about getting your flu shot in February or March, but is it too late to get one, and do they still have them available?
Flu shots are available. I can't guarantee that every pharmacy around here has them, but certainly a lot of places do. And there still is a benefit. We are in the middle of flu season, and while the flu shot takes about 2 weeks to really become effective, anyone that's had a bad case of the flu will know that it's much better not to get it. And so during the flu season, there's still definitely a benefit to get it, even at this time of year.
That's right, and it helps everyone. If one person gets it, everyone is a little bit healthier, right?
Exactly. I mean, that's one of the things that we have seen this year. We've seen some pretty severe cases of influenza that tended to occur in people that had underlying medical conditions. And it is definitely recommended that people with those medical conditions get the flu vaccine. And it's probably very good for those people if those healthy people around them also get it to protect them so they don't transmit it.
Okay, Dr. Kevin Shiley from Catholic Health, thank you so much. Important information, especially this time of year.
All right. Thank you, Lauren.